disclose, no financial relationship related to the content of this presentation. I'm going to be talking about concerned significant others and how to integrate them into treatment as usual. So thinking about brief engagement related to incorporating CSOs or family into the treatment that you're providing. So I'm going to go over some core concepts of sort of what are the best care standards regarding integrating them in, discussing sort of what are some of the issues and barriers around working with CSOs in the substance use intervention, and identify ways that regardless of sort of your role or your setting, that you can be creative to address those barriers and integrate those supports into the work that you're providing. So in order to start that conversation, we have to define some things. And so we hear this, what is family therapy, family intervention, family engagement? So what is a family? Let's start with that. Well, all of the practice standards really encourage us to think about this term very, very widely. And essentially, a family is whatever the client or the patient determines to be their family. So the answer to the question, who is most important to you? It could be really anyone in their social network that they're describing as family. So we want to be really loose with how we're defining that. It's not just people that live with them. It's not people from their family of origin or blood relationships, that it really could be anyone that they consider important in their life right now, that they would be willing to have involved in their treatment, that they would be willing to let you contact, speak with, work with, and invite into the service that's being provided. So of course, this is not limited to, but some categories that we may want to explore. If someone says, I have no one, to really be thoughtful about exploring that. It could be a parent, a grandparent, a previous guardian. It could be a romantic partner. It could be in-laws, siblings. We wouldn't want to include young children as a concerned significant other, but older children. So if they have adult children in their life that would like to be involved in their care, we could engage with them. It could be godparents, neighbors, other extended family, like blood relations, could be friends. We've even done some work with people who brought in a coworker. So somebody that they've worked with for many years that was close to them. They didn't really have any other supports in their life, and that coworker was willing to be a CSO. So we can think really broadly about what is that term. Why is this important to think about engaging and including concerned significant others into the work that we do? It's to recognize that when an individual has a disorder like addiction or substance use disorder, that can impact that entire network, that entire system. So it's not just affecting that one individual that you're treating, it's likely infecting everyone that they have close enduring ties to. It puts that system under a great deal of stress. It can disrupt routines, it can disrupt connections, it can be upsetting, angering, frightening for everybody involved. And so what can happen over time is these enduring connections, these relationships, regardless of what type of relationship it is, if it's a connected relationship, that can get dramatically impacted in a negative way when substance use presents. So it's sort of like a virus that can attack the entire system, right? And it upsets that equilibrium that's there and cause a lot of negative feedback loops to develop. And so if we don't engage with family or have conversations with them, we could be missing a big piece of the treatment puzzle. We could be missing some of the things that could potentially impact recovery goals, or we could be missing things that are setting people up to have slips or relapses. So in general, when addiction is presented within a system, whatever that social system is, it can increase or amplify the negativity that's present, the discord that is present amongst those individuals. So now we're dealing with oftentimes a relationship or relationships that have really been underscored or hallmarked by high levels of anger, resentment, hostility, and that has not only accrued over time, but it's continuing to be present in those interactions. And so the individual that we're treating, the identified patient, is likely to be dealing with high levels of that kind of resentment and hostility in what otherwise is considered close supportive connection. There also can be a lot of issues for the family members themselves, concern, fear, anxiety, misinformation about addiction itself, feelings of guilt and shame around why is this happening to my loved one? Is it my fault? Did I or should I have done something different to address it? And lots of this feelings of hopelessness, it's never going to get any better. There's nothing that I can, and helplessness, there's nothing that I can do to change it, right? So those things, when that's in a system, can really bind people up and prevent positive movement, even when we're providing the best care possible to the individual. If we're not addressing some of these issues within the family system itself, it could just persist regardless of the care that we're providing. The other thing that's important, why we want to routinely be contacting concerned significant others or CSOs and incorporating them into our treatment as usual, is because it impacts our community as well. So we know that addiction and trauma can cross generations. And it's especially true that if we're not addressing that system, it's going to impact the children within that household, and it's going to go into the next generation. So we know that kids that are growing up and exposed to substance use disorder, 70% higher incidence rates of experiencing abuse or neglect themselves, if that's present in the home. So recognizing that if we're providing effective treatment for the individual and the adults in their life, then that's going to have a trickle-down effect to have better protection and less vulnerability for the young people in their life. Because kids that grow up with this type of negativity within their family system, this type of substance use within their family system, are likely to have issues in school, likely to have issues with their own social networks, likely to have mood, attentional, executive functioning issues, and they are 4 times more likely to go on to develop a substance use themselves. So we know that can be part of when we see this like cross-generational impact within the communities that we're treating and the communities that we're working with. The other important concept is to recognize that this truly is a system. It's more than just a collection of individuals, that it takes on its own identity, its own dynamics. And so if we try to treat one individual in isolation, it's sort of like anyone who's ever worked on a car, if you have, you change one little thing to that engine, if I put the wrong size carburetor in, or I switch out a hose that didn't quite fit, then the whole thing can break down over time. So we have to recognize that anytime we're changing something within a system, even if it's in the positive direction, it's going to have an impact on how all of the other pieces fit together and function together. And so by bringing people in that are part of that system, we can help to address that at the very beginning and ideally offset any of those negative feedback loops that could potentially continue to hurt the individual or keep them stuck in their use pattern. Because we know that the family relationships are bidirectional. They can be one of the main things. That social support piece is one of the main things that helps people in recovery. It's one of the main things that sustains people in long-term recovery, but it can also be the #1 trigger for relapse. And it can be one of the main contributory factors why people stop taking their medication, why they stop coming to treatment, has to do with that dynamic that's going on. I already said this, that it repeats across generations. So we want to be thoughtful if we're thinking long-term, how am I an effective provider in my community? Am I thinking about what does community really mean? And that having a healthy family system means encouraging people to find that nice balance between connection and individuation. So if we're not addressing that in the work that we're doing, patients can fall on either side of that continuum, right? We want them to start thinking about how they can have support, reach out for support when they need it, ask to get those needs met in an effective way, but also take individual responsibility and recognize that they can make different choices and have different values from the people that are close to them. So to feel part of the whole, but also separate from the whole, is an important part of mental health. And that we also recognize that symptoms oftentimes have a meaning within a family system that may be different. If we're only looking at the individual in isolation, we may make certain assumptions about those symptoms, but within the system itself, it could actually be playing a very different role. And so it's really helpful to bring those people in as part of treatment, so that we're really treating the system and not just the individual. And so here's just some of the things that we talked about, is that, substance use may reflect other family difficulties. So thinking through, what might that mean for this individual? Are they playing a certain role? Is there some sort of abuse or abuse pattern within the system? Is there trauma or historical trauma that the substance use is actually a symptom of? Substance use can be maintained or exacerbated by family interactions. So when they have fights with their concerned significant other, or when certain events get triggered within that system, it could be a really high risk situation. This is an important statistic. Adults with substance use disorder are 5 times more likely to live with their parents or a family member from their family of origin than adults without a substance use disorder. So what are the implications of this? That's really important to be considering. If I'm treating an individual who's living at home, an adult that's living at home with their adult parents or grandparents or aunt or uncle who were part of raising them, the dynamic that they had when they were younger is going to be recreated in that system. And that could be helpful, or that could be really harmful to the autonomy and the growth of that individual. And so really thinking through, what is it that I'm dealing with? What potential landmines are there, and working with this individual, recognizing that they're at home with their adult parents, and their adult parents may not be supportive, or may not be educated, or may be coming from to the table with a perspective on Suboxone or on replacement medications, that we want to dispel those myths. We want to have a nice conversation with how they can be more supportive rather than a barrier to effective treatment. We also recognize that a lot of individuals will come to substance use treatment at the behest of family, or even forcibly coerced in a way to seek treatment. So if you don't go to treatment, if you don't take your medication, I'm not going to speak to you again. You can't live here anymore. Like that type of a mindset. I know that there was part of our culture for a while, this idea that it was helpful to do intervention. I think that was even a TV show that was on that people got exposed to, that if I threaten the relationship significantly, that will force my loved one to stop doing what they're doing and get better. The science is very clear that doesn't work. It works to get people in treatment initially, but it does not work to actually help people make the types of positive change that they need to make over the long run. And by threatening that relationship, it can cause a lot more harm than good. And so recognizing, if I'm working with somebody who maybe doesn't want to be actually doing this because they're in pre-contemplation, bringing the family in and helping them to think about ways that they can have some greater individuation of self. They can take care of themselves while they need to, while their loved one is in an acute place or is highly symptomatic. So those types of conversations can be very helpful. Sometimes families can sabotage a patient's treatment. Typically it's not intentional, although that does happen sometimes. Typically it's just ignorance. It's just a a concerned person who is misinformed or has a certain perspective that isn't taking all of the data into consideration, or has had a lot of negative experiences and had a lot of bridges burned, and so they're not going to be as supportive at this juncture in the patient's care. So thinking through how that might be playing out. We know that that positive change, like I said, if it's like a engine in a car, you change one thing out, even if it's a newer, more improved part, it's going to affect that entire system. And so as patients get better, as they stop using, as they stop being symptomatic, that could be threatening to that family system. A lot of the patients that I've worked with at ASAP have close supports in their life when they start treatment who they use with. And that's a big part of that social connectedness that they experience in their day-to-day life. And so sobriety really can threaten that sense of connection. And there's tremendous pressure for them to go back to using or to use within those relationships. And so really having to be thoughtful, can we bring those people in and treat them as well? Or how can we encourage them to have certain boundaries around the people in their life that are still continuing to use? The other thing is recognizing that women and adolescents really do need to be treated from a family intervention perspective. That if you're treating a woman or somebody under the age of 18 for substance use disorder, and you're not having regular contact with a concerned significant other in their life, you could be missing some really important pieces. There's a lot of evidence out there which has shown that women are much less successful in long-term recovery if they don't have the strong supports from their social network. So that's usually a partner, parent, child, like in that dynamic. If we're not engaging with and working with that, then we could really be missing an important piece for that individual's recovery. Now, what gets in the way of us doing this routinely? Because I think as a discipline, substance use disorder providers, we very much care about this population, or we wouldn't be working with them. Like, we're very passionate to help these individuals. So why do we tend to miss this piece? Why is this not a routine part of care? Well, there's a lot of barriers to engaging with family and getting them in. And I'm not talking about traditional structured family therapy. I'm just talking about bringing them in for some psychoeducation, having them contacted as part of treatment planning, like just making sure that they're involved in care. There's major barriers. Our clients have barriers. They feel, they oftentimes come with a lot of guilt and shame over how they've hurt, stolen from, lied, yelled at the people in their life, right? So those past wrongs can make it really hard for them to feel worthy, or for it to feel safe to engage with family members. They could have some unhelpful beliefs. This is very much a piece of United States culture, is this sort of idea that I can handle it myself, that I should be able to handle it myself. It's my problem. I'll reach out and build those bridges once I'm fixed, or once my life is in better working order, rather than understanding that, in fact, we all need support, that very few people, if ever, make major leaps in any type of positive change without support. Like, we very, very rarely, if ever, do that without somebody in our life. That there's always something there could be something that they don't want their family to know about. So making sure that we're talking very, very clearly and concretely about releases of information, what information would be shared, what information would not be shared. So routinely explaining, we would not be sharing your UA results. We would not be sharing if you're continuing to use or not. In any of those things, and really putting bookends around this is just to bring somebody in to share in general information about what is addiction, general information about Suboxone and how that can be effective, that it's not replacing one drug for another, right? What is the difference between addiction and dependence? Like, explaining those things to family members and being really clear with what will be shared and what won't. There's also family barriers. So the CSOs themselves may have guilt and shame over their inability to have helped or stopped the addictive behavior prior to now. They could have a lot of frustration or resentment over having helped and have it not result in change. There could be that sense of helplessness or powerlessness, that they're like, doesn't matter what I do, this continues. And then they could feel like they haven't been invited, or maybe they haven't been invited historically to be part of care for that individual. There's also barriers on our end. So there's staff barriers, feeling like, well, I've not gotten any training in doing family therapy. And so recognizing that's not what we're talking about. We're talking about just basic education and engagement. Just bringing people in to part of routine care is not the same as doing structured family therapy. Having a belief that maybe we shouldn't let anyone know that this person has an issue with addiction. And really looking at that, is that some kind of stigma that I might be carrying around, that people would be mistreated by someone in their life. 9 times out of 10, if you're going to bring somebody in as a CSO, they're already aware that the addiction is present. They're already aware that this person is in treatment, and that they're having issues. So this would not be surprising. This would not be new information. Believing that maybe it's too difficult to engage with family, we don't have enough time, maybe not having the types of supports by your facility. So not having the space, having funding for educational materials, having, I think this is an important one, support from administration to have the time to have those phone calls, to have that longer session, so that you can bring the person that's in the waiting room in and have that 15 or 20-minute conversation with them, right? So all of those things are legitimate reasons that get in the way to routinely doing this. What I want to leave you with is this idea that you don't have to engage the entire network, that if you can just engage a single concerned significant other, that will strengthen that entire social network and reinforce and motivate change for that individual. Families can be involved, or family members can be involved in really basic stuff. So learning about what is the treatment that they're in, what is a recovery process, what are the stages of change, participating in their intake or their treatment planning sessions. If you're going to go over education about how to use a medication, or what medications might be changing, to bring them in and have them be part of that teaching process. Having them attend separate set aside group or family appointments, if that's appropriate. Encouraging them to just come and be part of this at whatever level they feel comfortable with is important. But studies are very clear that treatment engagement overall, when you engage with just a single CSO, can improve as much as 60 to 70%, depending on what you're doing. Treatment retention and completion rates improve significantly, upwards of 77% across studies. And that a lot of the problems that can present within that system can be addressed by just incorporating them into the care that's being provided. One book that I highly, highly recommend is this blue one at the bottom, A Guide for Families Beyond Addiction: How Science and Kindness Help People Change. This is a really lovely book to just provide as a resource to anyone that you might be bringing in, because it goes through a lot of those common pitfalls that people experience with their loved ones, a lot of the misinformation about addiction, and a lot of ways that they can be a support, but not get involved in some of those negative feedback loops that are not helpful and could even be harmful for everybody involved. So it's a really nice companion for doing that type of work. And it's all informed by science. It's influenced by Kraft and CRA and basic CBT principles. And so it doesn't have any of the old language that we find in some other books. And then recognizing that when people want more involved intervention, that is available, that there are things like Kraft, CBT, there are CBT protocols and IPT protocols that have special family pullouts. Matrix has an entire group curriculum that they expect concerned significant others to participate in. There's therapies where they can actually go into someone's home, like multi-systemic family therapy. Brief strategic family therapy has shown good evidence. So there's lots of ways that we can get people involved. And it's really basic stuff, like asking them to just come and take a tour of the facility, having psychoeducation or groups available, even just to do things like Narcan training, having a list of sort of the more traditional family therapy referrals that are in your community that you can hand to people when they come in, and you're encouraging that. Looking at support groups like NAMI or other things that people can even access online, so they can get the support that they need themselves. Inviting them to be part of that first appointment or treatment planning appointment, or even something as small as just making yourself available with a direct line. If your patient signs a release of information, then they can take your phone number home to their loved one and say like, hey, if so-and-so has any questions about the medication that you're on, so-and-so has any concerns about what your treatment is going to include, just have them give me a call. And just making yourself available for those questions and that support, even that can go a really long way. Here's some more things that can be done when you think about ways to encourage family involvement. Oftentimes, making things available in the evening or weekends, if possible, can be helpful. Really having this idea of, as an organization, do we have a family philosophy of care? Do we really think about working with the whole system, or are we still very individually focused? When we're talking with clients, having them be involved in I routinely reach out to the people in your life. Who would that be? Who's important to you that could be involved in your care? Let's have you sign a release for that and have that conversation about what information I'm going to share and not share. Letting family know that they're a big part of how that individual is going to get better, and making sure that they're aware that they can help to get through some of that sense of helplessness or hopelessness. And then on the other side, being careful that we honor it if the family says, I don't want to be involved, that's okay too. And that we're not using any old terminology that really is outdated and unhelpful, like labeling people as resistant, codependent, or enabling. That a lot of that language doesn't have science to back it up, and is typically not the whole picture of what we're looking at. So coming at it from this sort of teaching collaborative mindset, and being patient and flexible to what's going on. And then lastly, I think when we're talking about engaging family, we're looking for ways that we can influence the 4 factors of recovery. So that's ways that family can help with good physical and mental health. What does that look like? What are ways that they can promote healthy eating, exercise, their home? So looking at ways that concerned significant others can get involved with supporting safe and stable housing. What would that look like? Talking about ways that their loved one can extend and really engage with purpose. So what does it mean to get out of bed in the morning? How can you be part of supporting that and talking them through that, helping them to volunteer or think about ways that they can have meaning and purpose in their life? And then lastly, how can this relationship be connected and an extension of that greater connection to community? So thinking through ways that they can integrate in, whether it's a spiritual community or community center, or some means that they are accessing and involved with their community in a healthy way. So CSOs can be part of all of this. So that's all I have on this topic. Did we want to take questions for just a minute before we go into